All right, welcome back to Problem Solver Politics. I am your host, Cardinellis, with Cody the Oracle.
Hey, everybody.
And today we got a really interesting video. We're going to start today's show talking about Andrew Yang's Medicare For All plan. I am going to quote myself. In the very first video that we made on Problem Solver Politics, it was, what is Andrew Yang and what is the freedom dividend? And do you remember, Cody, what my opening statement about my suppositions of Andrew Yang were?
No, it was a while ago.
It was a while ago, yes. I said, I think he's a Republican in sheep's clothing.
Yeah, we don't
because there were so many conservative ideas in his platform, right? So now there's this big stir that's going on about Andrew Yang's Medicare for All proposal. I think it's because he's in tune enough with reality to realize it won't work. Others say that he's betraying the soundbite of Medicare for All. It's causing a hullabaloo. Cody, please tell us what's going on.
Well, right now, the big news of the day, as far as what actually happened, is Andrew Yang. I'll take you to his website first. Andrew Yang on his website actually released what is a new way forward for healthcare in America. It's currently just in the form of a blog post. I believe he's going to have this tailored as a full policy proposal on his website pretty soon. But for right now, I wanted to go through this and highlight a couple things here. Talks a lot about we have the wrong conversation on healthcare. Instead of addressing the underlying problems driving unaffordability and access, we as Democrats are spending all of our time arguing over who is the most zealous and wanting to cover Americans, over who has to wanting to do so longer, over who cares about the health of Americans, which, yes, that is the argument. So we'll get more into that in a second. Scrolling down, this is a long thing. We'll probably do a bigger video soon going through everything he's talking about in here. Right now, I want to hit on the 6 kind of pronged approach he's bringing. And there's a Politico article. It's got some kind of analysis, talks about some of the same stuff I wanted to bring up. And like I said, later on, we'll do a full look at this. But anyway, so he says, in order to fix a broken healthcare system, here is this 6-pronged approach, him being Andrew Yang. 1, control the cost of life-saving prescription drugs through negotiating drug prices using international referencing pricing, forced licensing, public manufacturing facilities, and importation. 2, invest in technologies to finally make health service functions efficiently and reduce waste by utilizing modernized services like telehealth and assistive technology supported by measures such as state licensing laws.
Okay.
So we have 3, change the incentive structure by offering flexibility to providers, prioritizing patients over paperwork, and increasing the supply of practitioners. 4, shift our focus in educating ourselves in preventative care and end-of-life care options. Interesting. Ensure crucial aspects of well-being, including mental health, care for people with disabilities, HIV/AIDS detection and treatment, reproductive health, maternal care, dental, everything basically, into comprehensive care for the 21st century, and then diminish the influence of lobbyists and special interests in the healthcare industry that make it nearly impossible to draft and pass meaningful healthcare reform.
Draining the swamp. All right. Okay.
It's funny you mentioned that, and I'm going to highlight this actually in the Politico article here. And I guess I'll do it right now. When Andrew Yang's talking about negotiating drug prices, it's really interesting to mention. Here we go. So the negotiations, the article I was referencing, quote, these negotiations would be shaped by international reference pricing, an idea supported by some Democrats, and earlier this year by...
Oh, no!
Well, here's the thing, though, because I think it's because that is one of the... You hear a lot of healthcare and medical arguments, right, that they go all over the place. But one that doesn't make a lot of sense is if other countries are legitimately paying the same companies less money for their drugs, that's a problem. Like that is legitimately a problem. If one company sells them for one price to one country and one to another, we should be able to negotiate with these companies saying, well, hold on a minute. Why are you selling it to other?
Yeah. Why does France get penicillin for $5 and we get it for 50?
Exactly. So like, I definitely see why that's something logical enough to be bipartisan, where it's like, what partisan divided? Like, I don't know. I think America should pay more, right? Like it should be, no, we should work out more fair pricing. So that was one thing I wanted to get to, we go into this, but they mentioned a little bit here at the top I want to talk about. So they say that, here we go. Healthcare has not been one of Yang's signature issues. Very weird that they say that because actually, I wasn't going to bring this up, but this is a really valid criticism of Andrew Yang. And when we're talking about this healthcare rollout, I wanted to bring up a lot of not the criticism necessarily, but I want to bring up, like I said, like you brought the discussion around it. Like there's a lot of people with different takes on this. It's very fascinating. Again, I'm sorry it's taking a second. I actually had this pulled up and I closed it. I wasn't going to show it, but that is probably the best criticism of Andrew Yang I've heard ever. Is this Politico article mentions that healthcare has not been one of Yang's signature issues. Well,
even though it's in his top 3 on his website,
that's news to Andrew Yang. Medicare for All is one of his three big policies since the redesign to his website, which listed it in this function. Medicare for All has been number 2.
Well, hold on a second.
We're
This
gonna
has
get more
been
into
my
it,
thought.
But yeah, well, we'll take it. I want to take one more thing, and I want to get back to you on this because this is what I think is interesting. And we'll get into more of the policy stuff, but just because we're kind of already on this track, getting into some of the criticism. Now, I'm going to, anecdotally, me and Cardin, whenever we're on the street and we're interviewing people that are Yang supporters about Andrew Yang, we pretty much always wrap up the interview saying, so what's your favorite policy? Like, what's like and a lot of people say Medicare for All. And while I know it's one of the big 3 things, I'd always say, it's interesting if Medicare for All is your policy, you'd pick Yang as your candidate because this author who wrote this Politico piece didn't even really think of it as like a Yang policy. And myself included, I've always known that he's co-opted. I mean, I don't think it's in a negative way, but he's always said Medicare for All, but he's always leaned more towards, and they'll get through here what he's talking more about. It is
you and I are
closer
both,
to, it's not necessarily, it is not, and this is 100% true. Anyone who makes a statement, don't argue with them. This is not what Bernie Sanders considers to be Medicare. This is not what the kind of established progressive vision of M4A. What Yang is proposing is not it. And I do think the criticism of using Medicare for All, maybe, here's the thing though, nobody gets to just claim that. Nobody gets to say Medicare for All, this kind of nebulous term, means this thing that I decided, right? So,
well, Democrats are in a tough position because Bernie Sanders literally said in the last debate, I'm the best candidate for Medicare for All because I wrote the damn bill. And it was hilarious because, he's got the ultimate street cred for the communist approach, the democratic socialist approach, whatever you want to say, nationalized medicine. And Democrats are in a tough spot now because they've created their own monster in the sense that they've consistently pulled healthcare being the highest thing that people want to talk about. It's usually jobs and education. But recently, it's a chicken and egg argument. We don't know if all of a sudden healthcare is at the top because we legitimately have a problem because the healthcare system has been broken for 50 years. We don't know if there's something unique about the past 2 or 3, but it's been showing up consistently a sliver above jobs and education. And we're not sure if it's because we drove so much policy discussion, now it's on the top of people's mind and it's pulling higher, or if because there's a legitimate problem. So we got a chicken and egg argument with healthcare on the Democrat side of the aisle, actually in American politics in general. And you and I both said this when we first started covering Andrew Yang, Cody. We said there's 3 things. There were 3 video topics that we kind of avoided even because it was controversial in how we'd cover them because they didn't seem, quote, democratic. We would always say when people get a hold of the reality of his immigration policy, they'll realize he's practically tougher than Trump. When people get a hold of his gun control policy, he's going to get kicked out of the progressive club.
Well, no, his gun control policy was actually, he had to walk a lot of it back. A lot of it was just kind of ideas. Like, I reference this a lot, but he wanted to fine manufacturers $1 million of the weapon per
well, yeah.
But it's like, dude, like, there's weapons manufactured in China. Are we going to send him a bill? Like, it's not feasible.
Yeah, and then the third thing was we said, dude, everything he's said about Medicare for All really just kind of sounds like the public-private partnership system we got going on now with more euphemistic and flowery wording. And this idea that the government option will get so good that it will drive out private business and private healthcare. Yet there is no precedent of any program in the United States of America run by our government that has gotten so good it has eliminated the private version. Public education has not gotten so good that private schools had to shut their doors.
Let's get back to the topic here because I want to get back to this. And
I'm just saying he's in a pickle. This is a pickle because
here's the thing. People who want the more progressive Medicare for All, single payer, not abolish, but essentially make obsolete any kind of
and
private
that's not
structure.
Yang's plan. He's getting kicked out of the club here.
But I want to highlight one thing. We'll go, and this is going to be controversial. But first of all, I want to get back to the actual substance here, so we can talk about the substance for 1 second before we get back into the abstract. So this is again, I want to do a longer video, but Politico does a pretty good job of kind of highlighting a few things here. So we already mentioned they're saying what would Yang's 6-pronged plan do here? So we mentioned already the adoption of a kind of gauging our prices against other nations.
Well, three of those 6 talking points were Republican talking points.
But let's keep going. So he also proposes making telehealth services more widely available.
Rock on.
Licensing doctors to practice across state lines and creating a rural broadband internet network to reach underserved communities. Again, I don't think anyone's going to object to that because it's not X enough. He also proposes paying physicians by salary instead of by fee-for-service basis, doing more to shield providers from malpractice lawsuits, and incentivizing doctors to work in rural areas by forgiving student loans. That's a very interesting student loan forgiveness path I haven't heard. It could be a little bit scary, the idea of the government saying, you have to do something for us. But at the same time, it's like...
Well, they do this with teachers.
Yeah.
My sister was going to get debt forgiveness for going up to Palmdale to work as an SLP there.
It makes more sense to say, well, like I know that you took our money and graduated school, but how about we decide where you work and then you don't have to pay it back? Or you can decide where you work and pay it back. Choose one. That doesn't sound too crazy to me. But one more thing I want to get to, he said he's also would shift. This is what I actually care about more than anything. He wants to shift the focus of health systems to preventative care. Boost the coverage of mental health, care, vision, dental, reproductive, maternal. The idea being is if too many people are using our healthcare systems and it's straining them, which is true, perhaps we should be trying to work back. Like, obviously people that are already sick, we have to treat them. But like, how about people that are 10 years old right now? We incentivize them not needing to see a doctor every week and be on prescription medication for majority. I think there is ways to make the country healthier. It's got to start somewhere. I love the idea of a president saying, let's help the sick people now and then try to create less sick people in the future. Because that we can't just say let's help the sick people until the number of sick people just explodes until everyone's sick.
Well, we also have a very reactive.
Exactly. It's when you're always trying to catch up with all the people that are using the services and you never take time to say, what things can we do to help people? I mean, the Obama administration, Michelle took a lot of flack for this because of the implementation. The idea of trying to help kids start eating healthier and living healthier at elementary school wasn't awful.
That's a noble idea.
The implementation got a little bit, because it's the government and they're going to say, oh, this, that, and that. I mean, I always bring up, anyway, I don't want to get too off topic.
And it kind of turned into fat shaming, but.
Exactly. But the idea of a government program doing that, I've always been on board with. So anyway, they go to how would it work here? Yang's plans a combination of executive and regulatory actions he would take as president. He pledges to work with Congress on passing legislation and promises to pressure the healthcare industry to make reforms. These tactics in combination, he argues, would reduce high healthcare costs more swiftly and effectively than a full-scale overhaul. His plan doesn't have a cost estimate. Which I guess he can get away with not having a cost estimate.
There's a whole lot of nothing
because,
there.
Well, no, but I mean, if how can you have a cost estimate for I'm going to ask Congress to make changes to things? I don't know. Like, Congress has to pass the bill. So, because the reason why, you know why there is no cost estimate though? Because at no point is he saying the federal government he's not proposing what progressives would call real Medicare for all. He's not saying it's going to cost the government X amount of dollars to take over healthcare. He isn't saying that. He's instead saying we're going to roll out a series of changes and we're going to pressure companies to work better for people. Like I said, I personally like it. Here we go. They ask, what are the weaknesses of the proposal? Now, this is according to Politico. I've heard other weaknesses people have said, but this is according to the Politico article. They say, much of Yang's plan depends on Congress, the negotiation piece in particular. This year has shown how difficult it is to pass even modest healthcare fixes on Capitol Hill. If Yang was president, they're probably... I do fear a world where Yang gets elected in 2020 and how badly do we punish Donald Trump takes over the House and they can't even talk about, like, the House is so obsessed with, now that we're in power, now that Trump's out of office and is a private citizen again, how badly can we screw him and they'll hold up the House again? I don't think that'll happen. I'm just saying, I almost fear a world where it's like Donald Trump could be like 50 years dead and the House doesn't move. Like, Congress can't get anything passed because Donald Trump was president 30 years ago. Like, I almost fear a world where that scene.
No, because they're going to start investigating everybody that voted for him.
Or
they're going to be so busy investigating Ivanka and Donald Trump Jr.
But just the idea
and
of, like,
me.
Yeah. I think the criticism of Congress not really passing anything right now has a lot to do with the fact that Congress is currently impeaching the president, which is taking up their time, right? Like, that's why. Anyway, plan doesn't address the tens of millions of people who are uninsured or those who are struggling to pay their insurance plans high premiums, copays, or deductibles. It doesn't directly. However, one thing that people brought up is that it's part of what the freedom dividend's about. It's part of, like, okay, but the government is subsidizing you $1,000 a month, period. Some of that will go to healthcare. Some people will say that is definitely not Medicare for all, because it isn't. The other thing about that, when I'm talking about that, is it is true that he's not addressing, like, specifically these, like, there isn't any, this should be considered a, like, this shouldn't be in, so I'm looking for the buzzword, when you're sick before you get healthcare. My point being is there's none of that specifics in there.
You mean pre-existing conditions?
Pre-existing conditions. There's nothing like that specific. It does seem to me, though, like generally pressuring insurance companies to function differently could address those. Again, though, it's not an awful criticism. And additionally, like you brought up, it's not clear how he would accomplish several of the provisions in his plan. He pledges, for instance, to ensure Americans have access to comprehensive reproductive care, including STI screenings, contraception, and abortion. But he does not indicate what combination of executive orders and legislation that would entail, other than repealing Trump's Title X rule that cut funding to Planned Parenthood, which I would again say to them, yes, I imagine he would basically just set something up in the government and give the government that thing money, and like that's basically what Planned Parenthood was. The government gave them money to outsource some of these services. I think a more just straight up partnership. Like, I think if the government came out and said, we're not going to create this thing exists already, we're going to give them money and they're going to provide X, I think that'd be more likely. Anyway, now that we've gotten through that, the weaknesses, what do you agree with the weaknesses card? Anything you see in there?
Well, there's a couple things wrong with this. First off,
wrong or just kind of...
Well, I'm thinking two things simultaneously. First off, it's like Andrew Yang is too smart to put out ideas that he can't follow through on. And that's evidenced by the fact that he says, okay, the plan basically will rely predominantly upon Congress.
Yeah, actually doing things, right? Not just like some actually weird doing things. Concept.
And there's three problems he's fighting. First off, he's too smart to know Medicare for All in the progressive Bernie Sanders way that the public and the activists and the people that are going to be actually knocking doors and volunteering for campaigns that he needs. He's too smart to know he's too smart to know that he knows that would never work. You know what I'm saying? So he can't really espouse that because he's too smart to espouse that. But he wants the activists and he wants to be able to say I have a Medicare for All plan. Okay. However, if you're going to start giving specifics, those specifics will be lambasted and shot down as Republican talking points, just like Elizabeth Warren keeps telling anybody that doesn't have her plan or Bernie's plan that they're just Republican talking points. So he has to speak in euphemisms. I mean, if you look at this, he basically said, as president, I'm going to be really nice to Congress and work with them and we'll get stuff done. That's basically what he said. So the only thing he can deliver is this euphemistic gobbledygook that says, I know prescription drug prices are high and I think we should bring them down, but he doesn't say how. And then he says, the few details he can give are ideas that Republicans have tried to get passed through Congress for years, like allowing doctors to cross party lines or state lines, allowing Blue Cross of California to actually offer services in Blue Cross of Nevada or Blue Shield of Nevada being allowed to offer services and coverage plans in Southern California. I do not envy Andrew Yang right now because in the number one polled issue, he's too smart to give the progressive left what it wants to hear. You know what I'm saying? But must have a Medicare for All plan, or else he will go the way of John Delaney at the California GOP meeting where they boot him off the stage.
I remember if it was John Delaney, but I think
that was John Delaney. And he literally said, Look, guys, I don't think it's smart to tell the 300 million union members that have negotiated, collectively bargained healthcare plans that they need to get rid of the healthcare plans they've had for 30 years. That's just not smart or good governance. Boo! He got booed off stage and it tanked his candidacy before it starts.
Yeah. Well, no, I agree. And we've gone a little long on this without getting too in-depth into the policy. I want to get more depth into the policy one day. But
go for it.
I want to talk about a few more things here. So it's the last in the end of this Politico article, and they bring up something we've talked about a lot already, which is that, if Bernie Sanders progressive types want to say that this is not Medicare for all, then it's by his definition, it isn't. It's not necessarily a totally crazy thing to say. They also mentioned that pharmaceutical companies likely to fight tooth and nail. I guess I wanted to highlight a couple things before we moved on this though. Okay. One, and this is just, and I'm not trying. I just pulled a tweet. I was going through some of the comments, and I've seen people more or less speaking roughly something like this. So I want to bring it up. So
Okay.
And
this is a good
I always
tweet.
feel weird showing this stuff, but it's a tweet. It's public. People can see it. This is from,
Great name, by the way.
And again, this is
Lump.
just from a user, but it's just what regular people are saying. Because get back to what I said. Anecdotally, I speak to a lot of people. I ask them what their favorite Yang policy is. A lot of them say Medicare for All. I've seen a sentiment like this, that I'm worried for this campaign with the healthcare rollout. Half of the Yang Gang supports Andrew because he's repeatedly stated he's for Medicare for All. This plan seems to be changing nothing and just improving Medicare as is. My own continued support is tenuous. Again, it's just a Twitter user. It's one individual. This isn't a policymaker anywhere. But I do want to.
But isn't that literally the embodiment of what I just said, where he's too smart to actually embrace Bernie Sanders' Medicare for All? So he's coming up with this hybrid plan that doesn't have the sound bites or the talking points to keep the activists that you need in your campaign happy. Literally, he says, I'm worried about the campaign. Why? Because his Medicare for All plan. It seems to be changing nothing. Yeah, because Andrew Yang knows that it couldn't work.
There is a lot of
my
people,
own continued support is tenuous.
But there's a lot of people who also say I like this plan. I personally am more or less on board with it. Like it's not like doom and gloom. I'm not trying to paint that picture. I'm just trying to show people that this has been a thing where we've kind of seen this coming to a head where he says it's for Medicare for All. It's one of his top policies. He doesn't talk about it a lot. He isn't for the kind of progressive definition of it. And this is one last thing I want to touch on here. Now, full disclosure, this is basically centrist Hillary Clinton propaganda. But it's also why I'm showing it to you guys, because I want to show you guys what the centrist Hillary Clinton shill types are saying. No offense to this individual. It's just, I believe this Neera Tandine is literally worked for Hillary for a while and is a big fan of Hillary and is a big opponent to Bernie Sanders. So yeah. Keep that as a grain of salt. But this is what the opponents of Bernie Sanders are saying. This is unrelated. And again, this person does not like Bernie, is a Hillary shill, and is definitely against single payer. But this is what she had to say. She said, what you'll never hear on this website, but is true in this poll and previous ones, building a wall is more popular than single payer healthcare. According to this one Fox News poll, amongst whoever was asked here, these last two selections would be border wall and single payer. And I would say the better way of framing this is that support for single payer and support for the wall are about the same, which is very weird when you think about it. I'm assuming it's different people, but it is interesting, right? That there is that support level. And again, this is just one Fox News poll from somebody who is trying to take Bernie Sanders down. So I'm not saying this is proof of anything.
Yeah,
I just wanted to highlight the discussion.
It's proof, but Fox News does scientific polls, and I can guarantee you that there's a nuance here. I bet you a lot of those people that talked about building the wall is just a symbolic phrase for people that think you need comprehensive immigration reform.
It literally says building a wall along
I know
the
it does,
border.
but I'm saying when most people hear that, I don't think they necessarily think of a physical wall as much as a more stern take on immigration. I really don't think they have faith in the physical wall.
That is a massive assumption and editorialization, so I'm not going to work off of it.
Okay.
It's just according to me, I think this. That's cool.
Okay, I'm just saying that in all my dealings, when we talk with citizens, that is the impression I get.
Okay.
So all I'm guessing, and I do admit that this is a guess, is that the reason why that's more popular is because a lot of people think we have enough hospitals for our citizens. If we could revamp our system to be for citizens and not non-citizens, we could cover our bases. So that's why I think there's a strong correlation between those two questions, because there's people out there that are thinking, yes, we need to improve healthcare, but I think our system, if it were just for citizens and not non-citizens for free, would be sufficient.
Like I said, I don't take any. I'm not gonna mind read alleged voters, but my bigger thing is I just want to highlight that's the discussion out there. A lot of people are saying they like what he's rolling out there. A lot of people are saying we like this Andrew Yang thing. There is assault within the... I mean, this is, like I said, this is a Hillary person basically attacking Bernie Sanders. But this line of attack on Bernie Sanders that single payer is not popular is going to keep coming up. It's not going to be the first time. I've heard it before in the past. Single payer isn't popular is going to be an attack line from more centrist types towards the Bernie Sanders progressive wing. And I think Andrew Yang today kind of finally made it known where he stands on this. He's going to be standing in opposition to the progressives on healthcare. I think it's always been, like you said, as you've alluded to, we've kind of known that was the case, but he finally kind of came out and, kind of put the policy out there. Like, yes, I do stand in opposition with progressives on Medicare for All. I do not want the more, like I said, kind of like these Medicare for All, like the slogan, like the M4A. People recognize that is not what Andrew Yang's pushing for. So I just thought, I don't know. Sorry. I just wanted to end on that card. And that it seems to me that this was the day he finally said, okay, it's out there. I'm going to let you know. And there's going to be people that are upset at that. There's going to be people that are more or less happy with it, I think is what we're saying.
Yeah, and I think this will provide a deep divide in the Yang Gang, because one of the things we've loved about the Yang Gang is how diverse it is. You know what I'm saying? That it's a coalition of far left progressives all the way up to like far right libertarians and everybody in between. But there is also a reality out there that you cannot please everybody. You know what I'm saying? When you speak in generalities, you can please almost everybody. But when demands of details start coming out and the details are revealed, now all of a sudden you start realizing who you're going to piss off and who you're going to keep. And it looks like the far left progressives are the ones that are getting pissed off by Andrew Yang's Medicare For All plan.
Well, I mean, if you wanted single payer Medicare for all with no private insurance,
you're not going to get it.
Not with Andrew Yang, no.
Yep.
But like I said, I don't think that's necessarily the most popular thing either. I think there's some truth to what that Hillary surrogate had to say when she said it's not the most popular thing. I agree. I do not think it's the most popular thing. Polls seem to show up. Anyway,
make sure you subscribe to us on Twitter, because that's how we reach out to a lot of people, make a lot of our announcements. Also, if you want to contribute to the channel, there's a PayPal link in the description. And call us and leave a voicemail with your questions. We love responding to your voicemails, especially when we do our live streams on Tuesdays and Thursdays. That seems to be our most popular day. That's not exact set schedule, okay? So don't quote us.
Keep ours open 2020 for more stuff.
Yeah, exactly. By Jan 1, 2020, we are going to be doing a much more, not cohesive, but I would say kind of etched in stone, a lot more consistent live stream schedule. So anyway, love having you guys here. Like, share, subscribe if you can. This is Problem Solver Politics, and we will see you in the next video.